Okay, so you referenced major events like Easter, Mother's Day. There seems to be a slight surge after each of those. So one of our community members sent us some questions asking us how well Kaweah Delta is equipped for the new wave in light of the protests and the rallies, because there's not a lot of social distancing happening around those. And so, how equipped are we to handle that? And then they also wanted to know, how equipped are we to handle injuries caused by those protests or riots? And so far, I don't think we've had a few injuries here. I know last weekend there was an injury. So, how equipped are we to handle those at our facility?
Yeah, as I mentioned in the past, Kaweah Delta practices every single year. Multiple times a year we practice for any and all types of scenarios. We practice for the Kaweah Delta Dam to burst and flood the entire city of Visalia, and what would we do if it flooded our basement, which is where our laboratory is. And so I don't think we've ever practiced a riot. We definitely multi-car pileups on the highway where you have multiple injuries, some type of pesticide spraying a school or something like that, where we're inundated with hundreds of patients unexpectedly. So that's why we have the Hospital Emergency Incident Command System, which is what we're exercising right now in a real life situation. So we practice erecting that command center, deploying all these resources, calling in people. That's just what we do all the time. All hospitals are required to do that. So fortunately, we haven't had the violence that we've seen in some of the large metropolitan cities. We certainly, understandably, have had protests, and I think those protests will continue, but fortunately they've been peaceful protests. I did see the two young girls that got bumped by the Jeep, and fortunately they were minor injuries. So no matter what could potentially lead to a surge, whether it's Memorial Day and all the gatherings that occurred, or it's the opening up of the economy and society, or it's the protesting that brings people close together and in large numbers where they don't practice the social distancing and everything that we're looking for. No matter what the underlying cause of a COVID resurgence, we're ready. But again, it depends a lot on just how severe that surge is, and being able to coordinate well with the county, being able to use that alternative care site if necessary. The biggest challenge we have right now is staffing. We have, I mentioned, 40-something employees that are positive with the virus, and they're successfully fighting it at home. They're quarantined. They seem to be doing really well, and we're looking forward to them coming back to work. But many of those 40 employees are nurses, RNs. And so it's been a challenge to fully staff the hospital as the census has continued to grow. We actually are working with the county on potentially enlisting volunteer healthcare workers, or I think maybe close to 120 volunteer healthcare workers that have formally enrolled with the county that are willing to come. Even some come work with COVID patients. We have RNs and LVNs and MAs, but staffing has definitely been the biggest challenge, and that will continue to be the biggest challenge if we get hit with a big surge.